I'm Monica Robbins with your top 3 health headlines. A milestone in the fight against cancer. For the first time, 70% of cancer patients now survive 5 years or more after diagnosis. That's up from just 50% in the mid-70s. Now, the American Cancer Society reports the biggest gains are in previously fatal cancers like lung, liver, and myeloma. Cancer survivors are also living longer. However, nearly 2 million Americans will be diagnosed with cancer this year, and more than 600,000 will die from the disease. Researchers credit decades of federal funding for cancer research with these survival improvements, but recent cuts to that funding may impact cancer research down the road.
It's something we may not see until 2, 3, 5 years from now, even longer. The cuts are primarily to basic science, which are finding the mechanisms that we need to use to treat cancers, but not finding the things in the lab now will lead to fewer research trials later.
Dr. Shepard believes continued success in fighting cancer will be focusing on trying to get prevention nailed down. He strongly suggests people take advantage of cancer screenings because the earlier it's discovered, the better chances of a successful treatment. On January 31st, Medicare is ending coverage for most telehealth visits from home. Seniors will need to go to medical facilities for in-person care instead of using telehealth unless they live in rural areas or need behavioral health services. The change reverses pandemic-era waivers that allowed doctor visits by video from anywhere. Exceptions include dialysis patients and stroke treatment. Seniors may need to pay out of pocket or switch to Medicare Advantage plans to keep telehealth access. And about 800,000 fewer people signed up for Obamacare coverage through early January. That's compared to the same period last year. The federal government reports 22.8 million people signed up through January 3rd, compared to 23.6 million through the same period last year. The decline comes as the expiration of enhanced premium subsidies in December pushes up premiums, and on average, that expiration has doubled the price of premiums. Tomorrow is the last day people can enroll in plans on healthcare.gov. The final number of the total decline won't be available for a few more months. I'm Monica Robbins, and that's your Daily Dose.